Good afternoon. It's time for Public Affairs on WGEL. I'm Ryan Mifflin. Staying safe in this COVID-19 pandemic is the topic of today's Public Affairs program on WGEL. Jeff Lydell talks with Dr. Ryan Jennings, Chief Medical Officer at HSHS Holy Family Hospital in Greenville, about the effect of the pandemic at the hospital and how citizens can help themselves.
We're talking this afternoon with Dr. Ryan Jennings, and he's the Chief Medical Officer at HSHS Holy Family Hospital located in Greenville. And Ryan, it's been an interesting time with COVID, to say the least. With the latest surge of COVID cases, what effect has that had on Holy Family Hospital and its staff?
Well, you hit it spot on the head when you said that it's been an interesting time. We're now, more than 6 months into dealing with a lot of planning and a lot of well thought out processes around how to manage an influx of patients. And fortunately, we had a kind of an interval in there when that volume kind of flattened out. And now, as we're seeing, really since Labor Day, just progressively escalating numbers, resources, and best plans made now having to be reevaluated. So, what it's really created is an opportunity for us to demonstrate how we work across a healthcare system and across the region to make sure that we're delivering care that best meets the patient needs as close to home as possible, and really match those up then with resources across our health system as part of a multi-hospital system.
Has Holy Family Hospital saw many COVID patients?
We definitely have, and we originally had thought about the ability to just transfer patients, but reality has developed that folks that are appropriate to be able to continue to care for them there. We do have medications available there, the remdesivir and things like that you hear being talked about on TV and things like that. We do have, and so for a patient that is able to be safely cared for at Holy Family Hospital, we're keeping them there, and for patients that are requiring a higher level of care, then we're working very closely regionally to arrange for safe transfer. It's a bit of an evolution. When we were hopeful that the numbers would be small, we had one strategy, but as we're seeing those numbers grow and realizing how challenging it is for folks to have family members away, it's really become apparent that sometimes for the right patient, the best place to stay is close to home.
Have you experienced, or do you get the feeling that there's some people that maybe should be coming in to be checked that aren't doing so because of the entire situation?
This was something that we really saw a lot of, and I'm hoping as we see the numbers surge, we won't see this happen again, where folks stayed at home having chest pain or having stroke-like symptoms because they were concerned about coming to the hospital and the ability to be safe in the emergency department with patients that have COVID or potentially have COVID. So we saw many patients that delayed urgent treatment because of concern, and reality is that's not the right move. We have the ability to care for folks safely, to be able to isolate patients so that they can get the care that they need on an emergency basis. For folks that are mildly ill, certainly just like normal, call your primary care physician, get some advice, those types of things. But we never want to see, folks ignoring or delaying care for emergency medical conditions out of fear, because we certainly have put in processes that allow us to continue to take care of those emergencies.
Just because COVID is here doesn't mean that everything else that can get you doesn't. And there's the fear, too, that people are putting off seeing physicians, hospitals, for things that they've cropped up besides COVID.
Most definitely, and even in the primary care world, folks electing to delay things like mammograms and colonoscopies and those types of things, and that's definitely had an impact, in the long run on early diagnosis of some of those things. So we want to folks to continue to take care of their health needs in a timely fashion, and they can count on the fact that we've put processes in place to make sure that we can continue to do that safely.
Well, once again, what should everyone do to stop the spread of COVID?
Well, as we're coming into this holiday and we're all looking forward to the opportunity to at least take a breath, but, this is a unique year to make sure that we continue to try to do everything we can to minimize the amount of folks in a group, even with family gatherings. We've seen so many exposures that happen within a family because, once you're home, you feel like you're safe and you take off your masks and you do all those things, and then it turns out that, a family member was exposed at work. And so we've seen lots of things like that, even within households. So certainly as you're coming together with grandparents and things like that, trying to make sure that you're very careful about the distance that you try to keep with them. And of course, those bread and butter things, the hand washing is oh so important. That's true every year, not just this year, but every year. And masking when you're out and the distancing are all key. Probably the other thing to really hit on this year especially is flu vaccination. Certainly we don't want folks getting influenza and then also picking up COVID. COVID's rough enough and flu's rough enough when they're by themselves. If you get them together, you can certainly imagine that you could be critically ill very, very quickly. So I really would encourage folks to think about flu vaccine.
Can you remind us again what the symptoms are on the COVID?
Mild symptoms, probably the one that's the unique thing that a very large percent of people report is this loss of taste and smell, or at least a significant alteration in their taste and smell. And there's not too many things that do that. So, if you have that as a symptom, that's somebody that really should find out for sure if they have it so that they know how to appropriately isolate. Fever is a very dominant symptom in most folks, along with significant headache and just profound fatigue, just unbelievably exhausted. The more serious folks, though, start to have the more respiratory symptoms. They're short of breath. They start having chest discomfort with it, a worsening cough, those types of things. And certainly folks that have those more serious respiratory symptoms, they're feeling short of breath, they're having chest discomfort, they need to be seen, in the emergency department rather than just triage through their primary care physician. But for minor symptoms, going through your primary care doctor and then arranging for appropriate testing. And of course, the other thing that's unique to this disease is there's just almost any symptom we've seen at this point. There's a fair number of people that get abdominal symptoms. They get diarrhea, or they get nausea, which is a little unique too, because normally when you think about a respiratory illness, you don't think about having a lot of stomach things, and vice versa. This particular disease seems to want to span the spectrum on symptoms, similar to what we've seen around its unpredictability on how that it affects any one individual and how severe they become as far as illness.
Well, I have talked to some people who have tested positive who have not experienced the loss of smell and taste. So if that's the case, you just don't want to bank on that, do you?
No, you can't just bank on that. Now, the other way around, if you lose your taste and smell, you could probably bank that you've got it. But if you have other symptoms and you still have your taste and smell, it's very possible that you'd still have potentially COVID. And, really for somebody who's out in the public and able to not be hospitalized, testing's all about then making sure that we can isolate people and hopefully, stop the spread of this disease, because, we've seen everything from very, very elderly, fragile people get it and do absolutely fine, and very, very young people, unfortunately, have absolutely horrible disease with it and even fatalities. So the unpredictability lends itself to the idea of taking every possible precaution. The mask, everybody is inconvenienced by the mask, and I'm certainly not in love with mine by any means, but it's a small burden to keep others safe, and especially right now as we're looking at difficult times within the hospital and the first responder workforces, because they also have had a significant amount of disease. If you're not going to worry about the mask to protect yourself, you need to be thinking about it to protect those first responders and healthcare workers, because if you come in with something else, you sure want them at the bedside to help you.
Well, Dr. Jennings, once again, what should people do if they are experiencing these type of symptoms?
For mild symptoms, talking with your primary care provider is absolutely reasonable. Just picking up the phone and walking through your symptoms with them, determine if they feel that you need testing. But for severe symptoms and experiencing the shortness of breath, chest pain, those types of things, they need to be evaluated in the emergency room, and even potentially using 911, because this disease, when it goes to the bad side, it tends to transition very quickly. So, and again, same thing for other life-threatening conditions, the heart attacks and the strokes. Get into your emergency departments. They're there. They're ready to take care of you and do a way that's safe.
Do you feel pretty optimistic about what you hear concerning the COVID vaccines?
I am. The data, although a little bit preliminary as far as the number of folks that have received it up to this point, it's really exceptionally high numbers. Which even if it's not quite as good as their initial impressions are, it still should be more than adequate to eventually promote a great deal of immunity within the community. And once we're able to slow the spread of this thing, then it burns itself out. When you get to the point where one person can't give it to another one, or worse yet, give it to 10 other ones, once you get below a 1-to-1 transmission, then the disease starts to kind of burn itself out. So we've coordinated with the Departments of Public Health to begin the paperwork for allocation of vaccines that'll first be given to healthcare workers, first responders, those types of things, and are working across the state around the logistics for distribution of those vaccines. Because there's quite a bit of work that goes into that, but once those vaccines become available, we want to get them there. And then the public phase will follow, and of course that'll be a tremendous amount of work in coordination with the Departments of Public Health, who've just done an amazing job in managing what can be managed during this pandemic, and my hat's off to those public health servants that are out there helping us all to be successful.
I would imagine there's still a lot of research to be done just to find out what this virus actually is and what's causing it.
There definitely is, and just so many unknowns. It's amazing to me to think that basically this thing hit the United States, as far as we know, the end of February, beginning of March, and in 8 months, we've got medications that are directed at it. We've got a vaccine that should be out momentarily. We've seen the mortality within our own health system drop substantially since the onset of this, and really changed the initial thought processes around how we use ventilators and those types of things, from being very aggressive and quickly moving to that to now using other types of non-invasive ventilation and finding that to be as successful, if not more successful, in a certain subgroup. So it's incredible how much we've learned in just an incredibly short period of time. But that learning won't stop, and certainly as we roll into the phase of a post-vaccine era, what does that look like, and what does immunity look like, and if somebody had the disease versus somebody that got the vaccine. So many great questions that remain unanswered, but just can't underscore the speed with which medical community and the science industry, et cetera, have all come together to do incredible things. It really is amazing.
Well, Dr. Jennings, do you have anything else you want to give us on this topic?
Everybody, please be mindful this holiday, especially getting around your loved ones that are maybe not in the best of health. Be mindful to try to maintain distance, and, at all times, the masking, the hand washing, the distancing, and flu vaccines are really going to be key as we come past Thanksgiving into hopefully what will be a wonderful Christmas season as well. So folks just need to work hard to stay safe and use those things that we know help.
Well, I want to thank Dr. Ryan Jennings, the Chief Medical Officer at HSHS Holy Family Hospital, for talking with me this afternoon. Thank you, Doctor.
It's my pleasure. Happy to help anytime.